A first of its kind COVID treatment sparking new hope as many of us wonder if it's safe to gather for the holidays this year. That's not the only thing developing this morning in pandemic news. So here to talk about what's going on, Fox Medical Team's Beth Galvin. Good to have you here.
And it's good to be here, Bill. Thank you for having me.
All right, so Beth, we could see the first antiviral pill for COVID soon. So who exactly is this for?
So this is a pill that's being made by Merck, and it is Merck has applied for an emergency use authorization from the FDA, what they're targeting, the group that they're targeting is the at-risk folks for complications of COVID-19. So we're talking about some of the same people that might qualify for like monoclonal antibody treatments, people who are 60 and older, people who have very common health conditions like high blood pressure or diabetes, or they're obese or very overweight. Anybody who's likely to get in trouble if they contract this virus and have a mild to moderate case of it, and might need something to kind of help them get through this. This is a pill that you might be able to get from your doctor, a prescription for it that you can do at home without having to go to an infusion center and getting some kind of a more complicated, more expensive treatment.
So Beth, are we expecting Merck to get the green light that they want from the FDA, and what could the timetable be?
So Merck has submitted its study data to the agency. We don't know if they, what their independent scientists are going to decide on, how effective it is. The trial results look really promising, Bill. It showed, that it was able to half the risk of, hospitalization and death in the volunteers who got this pill as opposed to those who got a placebo. So it looks really promising. I guess we're going to have to wait and see on the data, before they really tease it out. But it'll probably be a few more weeks before the FDA meets to talk about this particular pill.
Now, Beth, we're starting to make plans for the holidays. How risky is it to gather in large groups indoors at this point, especially, for example, if we're traveling across the country?
So it's going to be a lot less risky for you if you're vaccinated. If you're vaccinated, you've done what you need to do at this point. It is risky still because we do have, even though, case numbers are dropping and hospitalizations are dropping, we're still seeing a high number of deaths, and we're still seeing a high level of transmission of the virus in the community. So when you bring people together from different households, some of them vaccinated, some of them unvaccinated, you don't know the status of some of your family members, and you're indoors, with poor circulation, that's kind of a recipe for the spread of the virus. So you do want to be cognizant of that. If you're going to be in mixed company with vaccinated, unvaccinated, or high-risk people, you want to be wearing a mask, and you want to be cognizant of some of the same issues we faced last Thanksgiving. Hopefully, it's going to be safer this year, but you don't want to let down your guard just yet.
And real quick, Beth, we've been talking a lot about at-home testing kits. What's the latest on that?
So I think these might be an excellent layering tool to add another layer of safety to your Thanksgiving gathering. You can test yourself. The best way to do it is to test yourself over several days leading up to Thanksgiving, and then maybe after you get home and travel. But, giving yourself a 10 to 15-minute test at home to make sure that you don't have an infection may work best with folks who are symptomatic. Important to remember, last thing, Bill, they're not foolproof, but they are a really good tool at kind of maybe catching something that you might otherwise miss. My niece did the test. She was headed over to see a high-risk relative out of town and realized she had the virus, and she canceled her trip. So it's really important because you sometimes don't know if you could be actively spreading the virus to other people, and you certainly don't want to do it at Thanksgiving with people you love and care about.
Absolutely. Beth Galvin, you are a wealth of medical information. Thank you so much for joining us. Appreciate it.
Thank you, Bill, for having me.
All right, have a terrific day.